Good morning, everybody. Appreciate you joining me. I'm Hal Wolf, and please allow me to share my screen with you. So give me 1 second and we'll get started on what I hope will be a good kickoff for this really terrific program put together in conjunction with Northern California. Thank you so much. Today, we're going to be hitting on a topic that is very near and dear to my heart, which is wrapped around the area of addressing healthcare equity through digital transformation. And it's an incredibly important avenue for each and every one of us. So before we get too far in, as we always do at HIMSS, we start every meeting talking about our vision and our mission. And of course, the vision of HIMSS is to realize the full health potential of every human everywhere. And nothing speaks to that more than health equality. How do we achieve it? But of course, through the reform of the global health ecosystem, and through the power of information and technology. So you can see that our efforts at HIMSS are absolutely aligned with this incredibly important topic. First of all, a big thank you to everyone who's not only attending today, of course, and also a thank you for everyone who attended at HIMSS 22. We had an amazing number of people, over 28,000, nearly 29,000 people participating in registration. We had over 1,000 speakers. It was just great feedback, and we're looking forward to April next year in Chicago for HIMSS 23. But of course, one of the highlights of HIMSS is always bringing lessons forward and sharing best practices and being thought leaders. So we appreciate that immensely. Our membership, of course, are the influencers, yourselves as members and those who should be members, and of course, the stakeholders all across the health ecosystem. And the membership at HIMSS is now over 120,000 members, with growth continuing in North America and tremendous growth also occurring in Europe and in Asia. So we just couldn't be more pleased because the whole world is really focused today on where digital health is going. And of course, when they think digital health, they often think of HIMSS. HIMSS is a very diversified organization. We're all over the world. We have meetings and events, and we also have, of course, offices and operate on a global basis. And I just hope each and every one of you understand how happy we are and thrilled that you're a part of the HIMSS family. So let's jump into our topic. You know, the fundamental question is that our actions really need to inspire others to dream more, to learn more, and to do more. And then you become a leader. And this is one of the main aspects that we need to talk about in health equity, because this is not something that will just happen on its own. It's something that we have to focus on and within the context of the global health ecosystem challenges. Now, these challenges have really continued to hang in there, if you would, over the last 5 years. First of all, we're all facing a growing population that needs care, the silver tsunami, if you would, the aging population. And on top of that, because we're living longer and we have more people in this generation, they're actually contracting a higher disease burden from a chronic care standpoint. Now, there's two aspects behind that. One, you're living longer, so you have more opportunity for that to occur. And of course, we're much, much better at detecting where these types of situations are going to present themselves. So we're catching it earlier, we're catching it longer. And on top of that, we have long COVID. Geographic displacement is a huge situation for us. We have people that do not have access to great care and quality. This is often painted sometimes as a rural situation, but it happens in our big cities where people live in the shadows of tremendous institutions but can't gain access. Funding is still very challenging. We have a lack of actionable information. We have staffing problems because simply there are not enough clinicians, and that gap will continue to grow in terms of taking care of people. And we have a highly educated and demanding consumer that we have now introduced to the new world of telehealth and even more digital health environments. But when you begin to think about health equity, it's really important to get this definition in mind. One is that equality needs to be looked at as differently than equity. Equality is an assumption that the access, or if you would, the benefits are the same for everybody, no matter whom they are. When you take equity into account, you're actually trying to create a level of fairness. You're trying to create something that supports everybody to an equal state. And that means you have to compensate and do things a little differently to ensure that each person can have the same experience. So it's not enough just to have a policy where one size fits all. You really have to think carefully about those around you. And health equity is driven by a number of gaps. When we think about the social determinants, and yesterday in a meeting with the regional directors of CMS here in Illinois, we also talked about the social influencers versus determinants. Either word really works, but where do you look for food security and social economic status? What level of education is involved? How do these become predictive modelers, as well as what you have on the social aspects of life, where you're looking at race and gender and sexual identity and class? All of these can really become structural determinants as well as fundamental social determinants. And these are all coming together to impact people. CMS released a new list of information that they're going to be requesting and tracking in a release that came out Monday, and they're asking for comment. And actually, the moment I'm finished here, I'm going down the hall to a meeting with CMS Administrator Brooks LeSueur. And this will be one of the topics. This is great to collect this information. What do we do with it? So these are some of the challenges that are sitting in front of us. And you have to put it in the context of what is healthcare as well. So I like to think of healthcare, quite frankly, as an anomaly within an anomaly. Now, we're going to spend a little time on those definitions because I think it's important. When you go back to the definition of equity, and we talk about the fact that we need to be able to adjust what we do in order to meet the individual, we have to recognize that we don't have uniforms approach. And we all know this. It's the old expression, if you've seen one hospital, you've seen one hospital. Because healthcare grows up in its own personality based on the facility, the floor, the individual that you're working with. And it's an anomaly as an industry, if you want to call it that, because it is ginormous. It is simply the largest economic institutions across the entire globe. When you think about the United States as a simple example, about 3.8%, less than 4% of our GDP is spent on defense. And that represents almost half the money spent on defense globally. And yet we spend over 19% on healthcare. So this is simply the largest global industry. The United States is not alone in that particular point. So it's an anomaly in the sense that it is so large and at the same time incredibly fractured. And it's going to get more and more fractured. So how do you approach equity when you recognize now that the data, the information, and the sources of care is no longer going to be just concentrated into one encounter-based paradigm that many of us grew up with? The second anomaly is how we actually define healthcare. Healthcare is all about finding the anomaly. What that means is that we go through a series of tests, we go through a series of protocols. We work very hard to figure out how are we going to find what is wrong with the individual, define it, and deliver care. That is what we do. So we find the anomaly and we put them on the right care pathway and we treat it. And the earlier we can find it, the better. And this is where digitization starts to take hold. And of course, people are hungry for it. We know that telehealth grew tremendously during the pandemic and will be much more a part of our lives. But the problem with telehealth and its surge is that it still often is based upon a one-to-one encounter paradigm. And that's a challenge because within our own statements we made before, we don't have enough clinicians to execute that. So it's not just a question of getting a clinician, nurse practitioner in a video consultation with someone one-to-one. Something has to step in between. And that lends itself fundamentally to the digital health transformation that we must deploy for two basic reasons. One, We cannot and will not be able to continue what we would call a face-to-face encounter paradigm for everybody. Those resources are very, very precious. And so how do we take these precious resources, which will always be in demand and always be in the forefront of care and delivery, and replace them with the opportunity to find the anomaly before it occurs or define it when it occurs without a face-to-face encounter? And this is where we have to start thinking about digital health and fundamental digital health substitution as a replacement for the physical testing in facilities. As an example, what can I do from home? How can it be done through AI and machine learning? And these are fundamentally these transformation pieces. And then how do I set up my organization to be able to take a look at those measurements and know that I'm preparing myself to take on a different world where data may be coming from Walgreens, it could be coming from an Apple Watch, it could be coming from a Fitbit, it might be coming from a home monitor. And how do I get the right applications to be able to do predictive modeling to know when I should actually engage in these precious resources? Now, of course, HIMSS is always there and ready to help. And when you think about digital health indicator, which takes not only all of our very successful maturity models, but does an overlay from a global benchmarking standpoint, focusing on personal enabled health, what's the status of interoperability for that data, the predictive analytics that needs to go with this, and the governance and workforce. This is beginning to be adopted on a global basis the way that NRAM has become the fundamental standard, of course, from EMR distribution. But when you think about analytics, continuity of care, and all of the other components of the maturity models coming together, we now have the ability to begin to measure both access as well as quality within these very important domains. And that allows us to begin to apply the readiness on a workforce basis, to be able to handle equity and applications on the outside that bring information back in to our provider domains. And this is where this critical junction point is going to continue to expand when you think about where the market is going. And Europe's a great example of that. They're going through the equivalent of meaningful use now. The European Union is funding the rollout of EMRs, but they are learning from us and taking that next step to say, what will I do with that information? How do I protect privacy? Make sure cybersecurity is in place, and yet have an aggregated view of the future so that I will be able to turn around and do predictive modeling at a population health element and down to the individual. And so where does this lead us in the United States? Well, we're in an interesting space. The healthcare systems, the medical model, if you would, our hospitals, our clinics, our traditional encounter-based paradigm has really been on a journey towards personalization. We've done so by starting with population health targets, which are basically kind of a mass production of a single target fits all. And we've been working really hard towards sub-segmentation, integrated medical conditions, and even the direction of personal genomics. But on top of that, which becomes very important, is to recognize that the consumer isn't standing still. While we're on a personal journey ourselves, are we moving fast enough? And the reality is that the health model, which is that Apple Watch, that phone, that Fitbit, that device, that home monitoring, that has really pushed forward in a huge and amazing way. So what that has happened is that what we're looking at this point in time is that these two are merging. And as they merge, we have to take the health model, which is the outside information, and bring it in conjunction with the medical model, as we saw in the previous slide, and then take that towards our health equity journey so that individuals who are not in a facility, whether we want them to be or they just don't have access to it, now can do the predictive modeling and expectation of care that they would have if they were sitting in a facility itself. And how do we spread our resources accordingly? So we've talked about these disruptors that are on the outside in conjunction with the health model. I'm here to tell you they're just going to continue to grow. They're going to grow aggressively, and they're going to produce a lot of data and information that we will all need in order for us to paint a full picture of an individual, whether they're in a rural setting, a city setting, or actually even sitting in our exam rooms, this information has to all come together. And yeah, interoperability is a big part of it. The people, the process, and the technology needs to come together. And this information is going to be sitting with the consumer, the patients, the payers, the physicians, and the care, the team operators, and the whole continuum of care with these disruptors. You got two choices. You can give them what we belovedly call the Heisman and stick your hand out and try to block the disruptors. But I will tell you that the most powerful bet you can make is to embrace them and figure out how to work with them. And we need to do our part to make sure that the data and the information can come together to create a powerful setting for people to learn and to thrive. Now, from that standpoint, it really gets down to this. This is up to us to make the decisions about how we're going to handle data, where we're going to go with it, and what we're going to do. This is what is behind our decisions that will help health equity, as well as our own operations and the expectations of the consumer that's in front of us. So I hope that this brief but fast-paced overview of the challenges inside our systems helps you set up what's going to be an amazing day today. Please remember a couple of things, and we'll finish with this. The future is in your hands. It's about you becoming the change makers that are going to have an influence and an impact on where healthcare is going. And secondly, health equity needs to be integrated into every part of your decision-making with the recognition that you're as responsible for the people that are outside the facility as in, because inevitably they will cross your door. Thank you. I hope you have an amazing time together, and I appreciate being able to be with you.